Hello everybody, I am Dr. Fernandes Melo from Brazil, and my speech today will be Hair Procedures Part 1. First of all, I want to thank Dr. Stephanie Leclerc-Mercier and Maite Iglesias and all Vichy L'Oréal team for the kind invitation. My topic today will be mesotherapy. Mesotherapy is a minimally invasive technique which uses locoregional injections directly into the dermis. It is widely used for scalp diseases like alopecia areata, so it's not a new technique. And it does work mainly in mild cases of the disease. Here you can see the before and after picture of an intralesional steroid injection for alopecia areata. And for androgenetic alopecia, in the past, we used it to buy vials for multiple applications, but currently we buy ampules separately and customize the blend. The main active that we use today are minoxidil and dutasteride, but you can use finasteride instead of dutasteride if you prefer. If you want to add some vitamins, you can choose biotin or deep panthenol, but it's important to highlight that the literature about these vitamins are scarce. So the main products that we recommend to use in mesotherapy are minoxidil and dutasteride. Let's move to this beautiful article published in 2021 in Dermatological Therapy. It was published by a great friend of mine, Dr. Barbara Rosell from Brazil. It's called intradermal injections with 0.5% minoxidil for the treatment of female androgenetic alopecia. It was a randomized placebo-controlled trial that showed that 0.5% minoxidil was better than placebo for female androgenetic alopecia. And these are two articles that I put together, published by another friend of mine from Spain, Dr. David Saceda Corralo. The first one was published in International Journal of Trichology, and this is the image of the article showing great response with the dutasteride in mesotherapy after 6 months in this patient. And this other one was published in the Journal of Drugs in Dermatology 2022. That is called Mesotherapy with dutasteride for androgenetic alopecia, retrospective study in real clinical practice. Dr. David and his team showed that dutasteride in mesotherapy is safe and effective and can be a good option for treat this disease. In practice, we mix the actives in a 3 ml syringe and apply it with this super thin purple needle, and after we dispose of the contaminated material. Unfortunately, we do not have guidelines regarding the frequency of application. In my experience, I do sessions monthly, and after 5 sessions, I perform this session in a maintenance therapy every 3 months. The ideal actives, the blends, the precise concentration, the frequency of applications, and the ideal number of sessions still need to be established. So let's see some clinical results. This is a patient suffering from a male androgenetic alopecia. The before picture shows this patient after 2 years of clinical treatment, and when we started to perform mesotherapy, we could see great improvement in the hair density, and he was super satisfied with this improvement. Here we go with a female androgenetic alopecia case. In women is challenging, and these women had a great response with 6-month sessions of mesotherapy. So in our experience, men respond better to mesotherapy than women, and pain can be a problem, so we recommend spray anesthetic before and vibrating anesthetic during mesotherapy, such as lidocaine spray and this vibratic device. We published it in 2020, this cosmetic commentary in the Journal of Cosmetic Dermatology that is called The Use of Vibrating Anesthetic Device Reduces the Pain of Mesotherapy Injections. It was a randomized split scalp study that showed 80% improvement of pain using vibratory anesthetics during mesotherapy. It's important to highlight and to dermatologists to be aware of this frontal edema and other side effects of mesotherapy. So we published it in 2021 in the Dermatologic Therapy, a case series of frontal edema due to mesotherapy for androgenetic alopecia. And fortunately, all of these patients evolved with good outcomes after 2 days. So I want to share with you our protocol here in Brazil. We perform mesotherapy starting with 0.05 to 0.1 ml per point, spacing of 1 to 2 centimeters. The volume per session is about 3 ml. And we recommend 5 sessions each Thursday. Then we can move to the maintenance therapy each 3 months. The dip varies from 2 to 4 millimeters, and we can expect initial response from 3 to 6 months. This is another suggestion of reading. We published this article in 2022 on the Journal of Cosmetic Dermatology. It is called Minimally Invasive Procedure for the Management of Male Pattern Hair Loss. And finally, I want to say thank to my team here in the State University of Rio de Janeiro. I am super glad to be part of this team. And thanks for everybody. Obrigado, merci. And this is my email and my Instagram. If you want to share experience or ask some question, I will be glad to answer and to read your experience and your comment and answer gladly. Okay? Have a great day, and thank you, everybody.